we're kind of far into this series. So I just want to say at the beginning, if you haven't been here, I've been working on balancing posterior pelvis by trying to loosen up posterior hip capsule. And a lot of us have one butt a lot tighter than the other. Most of the people, when I had them raise their hand, their left piriformis and outer hip were a lot tighter than the right. So I'm teaching from that. But if you know that always on the right posterior hip, you have more tightness, feel free to do that side first, because I'm doing the loosening side first. Does that make sense? Okay. All right, here we go. So we're going to start standing up again. And just have your feet hip width apart. And try to get your second toe to go straight ahead. So many of us stand with our feet out all the time, and our knees will turn in because they want to go straight ahead. And so then when we straighten out our feet and we get our second toes going straight ahead, our knees will tend to knock in when we bend them. So just be aware that you may have that configuration as you get your second toes going straight ahead, and you can try to just point the headlights of your knees straight ahead a little bit if you can. It's just requiring a little bit of external rotation in the thighs if you can feel that. And then just take your hands forward for a moment and reach the base of your skull back and see if you can balance your ear over your shoulder. Close your eyes for a minute and just feel how that is to have your second toe straight ahead. You have a little bit of rotation maybe in your thighs so that your knees are pointing straight ahead. You're trying to keep the base of the skull drawing back so that your ears are over your shoulders. Hopefully your core just engaged a little bit. You notice a little bit of activity in your transverse abdominis, just feeling that in the body and noticing the stability on the footbed. So you may notice yourself swaying side to side, rocking back and forth, or even rotating in a circle as your body tries to find its alignment in this stance. All of it is good. None of it is bad. You're just noticing. And then go ahead and look down at your feet. And we've been starting with the big toe. So we just want to lift up both big toes and place them down, maybe about 20 times. If that's difficult to isolate for you, you can try placing your hands above your feet and just lifting your thumbs up. And as you lift your thumbs up, sometimes that will pop your big toe up. Now, as you're taking this little action, just notice the inner arch, the inner ankle, the inner knee, all the way up your inseam towards the pelvic floor, and just notice what kind of activation you can get as that toe pulls up. One side may be much easier to lift up than the other side. You can even do one toe at a time. Just do the right side and feel what kind of responsiveness you have on the inseam of that leg. And then try the other side and just notice oftentimes that side that we have the tightness in the posterior hip will have a lot more difficulty rising and lowering. There'll be a sense of clunkiness on that side. So just noticing the difference between your two sides, and then let that go and come back to your stance. How did that very minor action in the body even just begin to awaken some of your musculature? Can you feel your glutes a little bit more activated? And then go ahead and lift up, plant your big toes into the mat firmly, and then just lift up the other 4 toes. And again, you might be able to help yourself by lifting up the pinky side of your hand. You're trying to keep your big toes flush to the mat while you're lifting up the other 4 toes. Notice the outer ankle bone, the outer knee, the outer hip. How easy or difficult is it to activate the outseam of your leg? And then maybe just try one side at a time. Try your easy side first, the side with the looser posterior hip, and then try the side with the tightness on it. And just notice if there's more restriction, more clunkiness, there's less of a sense of coordination and capability in that outer hip, maybe. For 3 and 2 and 1, and then just go back to both for a couple, and then we'll take our hands forward again and just notice how that little activity hopefully got us a little bit more into the glute max. We're looking to activate that very large muscle, which is responsible for most of our walking, or should be. And the reason we get this tightness out of here a lot of times is because piriformis and glute med, which are smaller muscles, are trying to take over what rightfully belongs activity-wise to the glute max. Okay, so now we're going to go ahead and come down onto the mat and take your left foot forward, take your hands onto your blocks, and take your right leg back into a lunge. And if you want to do this whole exercise with your knee down, that's completely fine with me. And we're going to just take a little sitting bone circle to begin with. So make a sitting bone circle. Left sitting bone is moving. Your right hip is going to move too, but it's following, it's passive. And then we're going to go the other direction for 3 and 2 and 1. And just take a moment and straighten your front leg. I've got my left leg forward, but if you know your right posterior hip capsule is the tight one, you can take your right foot forward now instead. Just press your left big toe mound forward and fan your foot side to side and feel the back line of the left leg. And as you're rolling through those hamstrings, we're on the tight side, wherever you are, you're just noticing how the back line of that leg is. And then we're going to rebend and just tip your big toe up, and then drop your big toe and tip your 4 other toes up, and just go side to side for a moment and just notice as your knee comes in and out what's happening in your hip capsule. So as your knee goes out to the side, you want to try to bump your left hip out to the left, or if you're on the right side, out to the right as you pick up your big toe. And then as you draw your knee in, just let that whole outer hip draw in towards the hip capsule a little bit. So you're just noticing this little rocking motion there. And then the next time your big toe is up, lift up your inner arch, your inner ankle, your inner knee a little more. Bump your left hip out tiny bit to the left, and then set your big toe mound down so that you've got your foot planted, but your hip is still a little bit loosened from where it usually is. And we're just going to take our blocks a little bit forward and launch off the back foot with a little bit more weight into the front foot than we've been working over the past weeks with our hip capsule, a little bit letting go of that femur head that is usually so tightly sucked in. So just launch forward on your right big toe mound and backward a few times, and just feel what it's like to get a little weight in that foot while the hip capsule is not so gripped tight. For 3 and 2 and 1, and then go ahead and straighten that left leg again, spread the toes and fan the foot side to side. For 3 and 2 and 1. And then we're just going to step that left foot back and step the right foot forward. Now we're on the side that's not so tight for everybody, so you may have gone over to the left side. And just go ahead and straighten that leg for a moment, spread your toes and fan your foot side to side. 3, 2 and 1. Now bend the knee and make a little sitting bone circle with your right sitting bone. And then go the other direction. For 3 and 2 and 1. Now take that action we started the class with. So lift first your big toe, your inner arch, your inner ankle, your inner knee, and let your knee jut out to the side. And then lift the other 4 toes and just start to rock your foot side to side, and notice the balance on this side in the hip capsule. And as I was saying last week when we were doing this rebalancing work, this side may be a little loose, or it could be more neutral, but just notice how we went from the tight side to the side where there's more room. And next time you stop with your big toe up, your inner arch, your inner ankle, your inner knee is lifting, go ahead and put your big toe down. And you could bump this side out, or if it feels like a little loose, a little unstable, you could even pull it in a little bit, or you could leave it in a more neutral place. And then just launch off the back foot, put a little weight into that foot, and just feel what kind of different musculature is activated as you take some weight into that foot with whatever level of pulling in you've chosen for that hip capsule. Sometimes when we're rebalancing the pelvis, all kinds of different muscles start to activate that we don't usually use. And then next time you come back, go ahead and straighten that front leg, lift and spread your right toes and fan that foot side to side. Notice if you're having any different sensation of stretch in the hamstrings from having that hip capsule in a slightly different arrangement. For 3 and 2 and 1. And then we're going to step back. We're going to come onto all fours. Again, I'm going to start on the left because that's my tight butt cheek over there. And so you want to start on your tighter side, wherever you have more discomfort. Let's take some dog cats first, just in the center, lifting tail, sinking belly, lengthening base of skull up away from the shoulder tops, looking up, and then exhaling, tucking tail, lifting between the shoulder blades, letting base of skull drape towards top of head. Inhale, dog tilting. And exhale, cat arching. Inhale, dog tilting. And exhale, cat arching. And then just go ahead and draw your knees a little closer together. Try to keep your belly button right over the mat. And without wonking your whole body over towards the right, try to keep your belly button over the center line. We're just going to step that left foot back and take a little bit of a dog tilt and a little bit of a cat arch. And as we cat arch, we're going to swing our left foot around to the side. And then as we inhale, we're going to take it back and come into a little dog tilt. And then as we exhale, we're going to take it out to the side. Okay, so now pull your knee in and we're going to do that same action, but first we're going to set the hip like we were doing a moment ago. So back up to the back of your mat. Just take your left foot forward a little bit. Rock it up. Again, take your right side first if you know that's the tight side. There were 2 people who were on that side. So rock your foot up, big toe mount, inner arch, inner ankle, inner knee, jutting out to your left, and then just bump your left hip out to the left a little bit so that you can feel a little bit more room growing there. And then we're just going to forward the body so that the weight comes into the foot like that and drop the knee down. And then we're going to come back. Oh, sorry, I did it on the wrong side. No, I did it on the right side. Whoa. All right. So now I've got the weight into my left knee. I've got my hip bumped out a little bit, and I'm going to take my right foot back. Try to keep your navel right over the center of the mat, and inhale, dog tilt, and exhale, cat arch, and swing your foot around to the right, and inhale, dog tilt. And exhale, cat arch. And just again, notice if that little bit of a change in the hip capsule makes a big difference in the way that you're using your back and your dog tilting and your cat arching. And then this time as you dog tilt, go ahead and bend the knee and lift the foot above the knee like a dog peeing on a hydrant. And then exhale and come around, cat arch. And inhale and dog tilt. And exhale and cat arch. And inhale and dog tilt. And we're looking for a stretchy sensation in that hip and ligaments around it and the pelvis, but no pain. If you get pain, just back off a little bit. This time, hold your cat arch and go ahead and just lift and lower your tail. So I've got the cat arch right between the shoulder blades, but I'm trying a little dog cat tilt in my tail and just seeing how that feels as I'm gliding the pelvis over the stable femur head right now. For 3 and 2 and 1, and then just bring that right leg back in and take a dog tilt and a cat arch. Notice what you might have changed. And then we're going to back up to the back of the mat again. We're going to step the loose foot forward. We're going to rock it a few times, and then next time the big toe mound is up, pull up the inner arch, the inner ankle, the inner knee. We've got the right knee sitting out to the side. And you can either bump the hip out if it's a little tight too, or if you feel like it's a little loose, when you put your big toe mound down, you can pull it in or leave it neutral. And then just weight the body forward so that that weight comes into the foot, and then take that knee down. And then reach your left foot back. Try to keep your belly button over the center of the mat. Inhale, dog tilt. Exhale, swing around, cat arch. Inhale, dog tilt. Exhale, cat arch. Inhale, dog tilt. Exhale, cat arch. Inhale, dog tilt. And this time, go ahead, bend the knee, lift the foot up, and then exhale, cat arch. Just noticing what kind of different musculature you're using on that side, depending on where you chose to bump the hip out to. Inhale, dog tilt. Exhale, cat arch. Inhale, dog tilt. Exhale, cat arch. Now leave your cat arch between the shoulder blades, and then just take the tail through a little pelvic tilt, and just notice how you're using that musculature differently than you usually do, for 3 and 2 and 1. And then just bring your knee back in and take a full dog cat tilt. And go ahead and turn your hands over. If it's too much to do both at a time, just do one hand, and then just take your body in a little circle, spread your thumb and your pinky apart, and then go the other direction. And then turn your hands out to the sides. Again, if it's too much, you can do one hand at a time, a couple rotations, and then the other hand. And then go the other direction. 3, 2, 1. And then take your hands face down, fingers towards the knees. Reach your thumbs out to the side, and then bend your elbows and sit your tail back towards your heels. And then just very slowly peel your palms up, reaching your thumbs as far as you can out to sides and bending elbow. You might need to jiggle back and forth like this to get a little bit of height in those palms without lifting your fingers up. You're trying to keep your fingers on the mat. And then you can go ahead and peel up your hands, shake your hands out, and come downward facing dog. And just bending one knee at a time. Just notice any change that you made in that little exercise, balancing the pelvis. And then we're just going to walk the feet all the way forward. Inhale, look halfway up, put your hands on your blocks, and exhale, step your right foot back. Take an easy inhale. As you exhale, slightly straighten your front leg, cat arch your back, let your head go. Lift and spread your left toes and fan your foot side to side for 3 and 2 and 1. And then drop your right knee and the left foot comes down, and watch where your left edge of sacrum is. See if you can drop it back and drop your left sitting bone down so you've got a little bit more equilibration in the pelvis. We're looking for activity in the right glute and the right hamstring. So if you don't feel your right hamstring working, make the action of pulling your right heel up towards your glute to try to get the entire back leg on. And then just rock your left foot. Take that little action of the left foot rocking. And next time your big toe is up, lift that inner arch, inner ankle, inner knee. Bump that hip out to the side. Feel free to do this on the right if you know you're tight on the right. And then put your big toe mound back down. So now we've got that new position of the left hip. It's a little bit more exterior. Your right leg should be working a lot harder than it usually works. And then we're going to try to swing the whole pelvis forward, plant the left hand into the left thigh. Right palm comes forward and rises up. I hope your right leg is really feeling this work. Open from sternum to collarbone. Lengthen base of skull from the shoulder top as you look up. Try not to shear your ribs forward, but breathe into this area right under the collarbones for 3 and 2 and 1. And then go ahead and let that go. Pick up your left foot, straighten the leg out and set the heel back down, pushing into left big toe mound, and fan that foot side to side. And just rolling through that stretch of all 3 hamstrings. 3, 2, 1. Now walk your blocks over towards the right. Walk your left block a little further than your right block and press your pelvis over to the left side of the mat. Push your right knee into the ground and turn your belly from left to right a little bit. And then creep your left fingers forward even more and breathe into your outer left ribs. Take a big inhale, spread your left rib tips, and exhale out the belly. Inhale there, and exhale out belly. Inhale, and exhale out the belly. And then inhale a little higher up on the outside of your breast tissue. Spread the upper ribs apart. Exhale out the belly. Inhale, upper ribs. Exhale. Inhale. And exhale. And then firm your right hand into the block, unfurl left arm up to the sky, and just go ahead and drape your right ear down towards your right shoulder. See what you can do to encourage the left side of your neck and your left shoulder top to just lengthen out like taffy, not pulling or forcing, but just letting your head drape down, letting it go more and more and more for 3 and 2 and 1. And then sit your left shoulder blade back. Take your left hand and reach it far around you. Pull your left shoulder blade down towards the left edge of your pelvis so that you can feel that left pec minor area, apical lung area, filling up with air on the inhalation. Now dive your left hand into your right side waist, keeping your head draping down. Just lift that shoulder top up and forward and down. It's making a little clockwise shoulder roll for 3 and 2 and 1. And then we're going to release that hand down to the block, walk it underneath the right hand, flip the palm over and cinch the hand towards the back of the block, but step your shoulder blade, your left shoulder blade, towards the front of the mat. Pull it away from your spine, breathing into that space between the left edge of your spine and the left medial edge of your shoulder blade for 3 and 2 and 1. And then release, unwind, and turn towards the right side of your mat. You want your right knee a little bit outside of your right hip, and you're squeezing an imaginary ball between your thighs. So right now, this hip, even though that hip we were sitting out a little bit, it's actually pulling in towards the socket a little bit because I'm making this action, this midline action at the thighs and at the hip crest and at the low ribs. And then just take your block behind your head, press the base of your skull so that you've got your ears over your shoulders, just like we did at the beginning of the practice. And just feel that. You could close your eyes for a minute because this is where we started the practice, trying to feel that balance without shearing the rib cage. And then inhale and exhale your left elbow down towards your left knee. See if you can pull your right elbow back and breathe into your right low ribs for 3 and 2 and 1. And then inhale your way up. And exhale the right elbow down and pull your left elbow back slightly and breathe into your lower left ribs for 3 and 2 and 1. And then coming up and going down the first side. And we're going to breathe a little higher into our upper right ribs. Draw your right elbow back. Spread your right rib tips on the inhalation. 3 and 2 and 1, and then coming back up to center and going back down. Draw that left elbow back, breathe into upper left ribs for 3 and 2 and 1. And then we're going to inhale our way up, turn towards the left elbow, reach your right elbow towards the floor. Let that right shoulder blade wrap around like it's following the elbow and trying to escape away from the right edge of the spine. And then breathe into the bottom tip of that shoulder blade for 3 and 2, and 1. On your next inhalation, open your right wing up, look up towards your right elbow, pull your right shoulder blade down towards the pelvis and breathe in under your collarbone for 3, and 2, and 1. And then go ahead and let that go. Turn back towards the front, tuck your right toes under. Exhale, cat arching. This time you're going to block your left foot. You're trying to get the entire ball of your foot up and over that left block. Pull your left hip back for 3, and 2, and 1. And then go ahead and step your right foot forward a little bit or a lot, depending on where the back line of your leg is. Lift the tail on the inhalation, reach the sternum forward. And as you exhale, drop your outer left heel a little more deeply into the mat and let your hips shift over to the left. Feel the outer edge of your calf engaging for 3, or stretching, excuse me, and 2, and 1. Inhale to center, exhale, the inner left heel is dropping into the mat. Your hips are shifting over towards the right for 3, and 2, and 1. And then just go side to side and just feel that dynamic stretch in the calf for 3, and 2, and 1. Now all the weight goes on the right foot. Turn your block, step your left foot on the block so that your toes are parallel, and walk your other block over towards the right. Reach your left hand further than your right hand. Straighten your left leg any amount and bump your left hip over towards the left. That's the action we've been taking since the beginning, and you might notice a little bit more openness in that posterior hip capsule. And then breathe into the outer left ribs, the lower and the upper ribs, spreading those rib tips, and exhaling out the belly. And then rebend left knee, walk the block back, take your fingertips on it, step your right foot back, left forearm buried into the right thigh. Now, we haven't done this here in the last couple of classes. If it makes you feel unsteady, you can put your whole hand down onto your block, but you're going to tip your big toe mound up on the left foot, pick up that inner arch, that inner ankle, that inner knee a little bit as the knee comes out to the side, and just again give that little bump of the hip towards the left, and then set your big toe mound back down. Again, if you're feeling unstable there, you can put your whole hand on the block, but you're just trying a little bit more room in the hip capsule as you swing the hips forward into a dog tilt, raised base of skull. And you're trying not to shear your hips forward, your ribs forward as your hips come forward, and then you're going to breathe into that area right under the collarbone. Pick up the back of your right knee for 3, and 2, and 1, and then just exhale and swing through cat arching. And then inhale and swing forward again. Could be a lot more work or work in different muscles than you usually feel. Breathe into upper chest. Drop your shoulder blades towards the back rim of the pelvis as you pick up the back of the knee for 3, and 2, and 1. Now keep that QL movement of the shoulder blades reaching for the back of the pelvis, and start to drop the low front ribs towards the pubic bone till you feel the front edge and the back edge of your abdomen co-activated for 3, and 2, and 1. And then exhale, swing through and cat arch. 3, 2, and 1. And then go ahead and take your right knee down, drop your block a little bit, and then creep your left fingers forward as your left hip reaches back. Try to elongate that left side waist. Now, because we took the hip out just a tiny bit, you might feel a little bit more room there around your left sitting bone. You can take a little sitting bone circle here if you've got the room for it, and you can feel a lot of stretch all around inner groins adductors, 3, 2, and 1. And then we're going to take all the weight into the right hand and unfurl left hand up to sky. Step the left shoulder blade back and let the left hand come a little further back. Drop your left shoulder blade towards the back rim of the pelvis. Breathe into that upper chest area for 3, and 2, and 1. And then release. We're going to take that left hand, snuggle it into the left arch of the foot. Right block comes down a notch, hand comes on it, and then lift the back of that right knee one more time. Sit down into that left sitting bone. See if you can squeeze an imaginary block between your thighs, your hips, and your ribs. Go wider across the collarbones and then pick up your dolphin fin between the shoulder blades. Pick up the base of the skull towards the ceiling in that gesture of balancing ears over shoulders we were making at the beginning of the practice. And finally, sew your navel up to your spine. Pull it up under your rib cage a little bit. Soften your neck. You could take a little figure 8 with your nose. The whole body is working hard, but you want the neck to be as soft as it can be. For 3, and 2, and 1. And then we're just going to step that left foot back. Here we are, downward facing dog. Our hands are on our blocks. Just noticing the difference between the two sides. And if we made any headway, loosening up that posterior hip capsule on the left side. For 3, and 2, and 1. And then take an easy inhale. And as you exhale, glue your knees together and drop your knees an inch above the mat. You're squeezing an imaginary block, very skinny block, between those knees. Your knees are actually touching. And then you're going to swing your knees over towards the right. Try not to let your left knee get behind your right knee. Left knee wants to keep up with the right knee. Then you're going to reach your left sitting bone towards the left heel and breathe into the bottom tip of your right shoulder blade. For 3, and 2, and 1. And then inhale, downward facing dog. Exhale here. Inhale. Glue your knees together and exhale your knees an inch above the ground. And on your next inhalation, swing your knees over towards the left. Try not to let your right knee get behind your left knee. See if it can keep up. Reach over as much as your left knee is. And then just reach your right sitting bone towards your right heel. For 3, breathe into bottom tip of left shoulder blade. And 2. And 1. Now keep your right thigh moving with your right belly as you launch up on the ball of the left foot. Your right thigh is lifting higher and higher into the belly. You're going to spread your collarbones, but at the same time, lift that dolphin fin, lift the base of skull, lift the pelvis. Everything's getting higher, higher, higher. For 3, and 2, and 1. And then just pull your right toes towards your face. Flex your foot as much as you can, and then step that foot in between the hands. And then draw your blocks up to the highest height. Left foot is going to hop forward a little bit. Take an easy inhale here as you exhale. Slightly straighten your front leg. Cat arch your back. Let your head go. Lift and spread your right toes. Fan your foot side to side. For 3, and 2, and 1. And then left knee comes down and right heel comes down. And we're going to check in with that right edge of sacrum. So see if you can draw it back so it's at the same place the left hip is. And then drop that left sitting bone down, trying to equilibrate the pelvis. Your left glute should be on. You should feel your left hamstring working. If you need more work, you can make the action of picking your left heel up towards the glute to activate that back leg. You really want a lot of stability there. And then we're just going to start to rock the right foot side to side. Next time you've got your right big toe up, you're going to lift up your inner arch, your inner ankle, your inner knee. You're going to choose how much you want to bump this hip out. Depending on if it's a little loose, you might even pull it in, and then drop your right big toe mound down. And whatever new position you've chosen, hopefully that's causing more work in the left leg. You want to feel a new position, a new proprioception, a new intelligence in your left leg. Bury your right hand into your right thigh. Left palm comes forward and up. Drop your shoulder blades down towards the pelvis. Try not to lose your low ribs, but open up. Upper front intercostals as the base of the skull stretches away from the shoulder tops. Breathe up under your collarbones. For 3 and 2 and 1, and then let that go. Pick up your right foot, set it down, lift and spread your right toes, fan your foot side to side. For 3 and 2 and 1. Now we're going to walk our blocks over towards the left. Let your right block walk a little further than your left block. Pin your hips over towards the right edge of your mat. Press your left knee into the floor and turn your belly from right to left slightly. And then creep your fingers forward, forward, forward on the block. Cinch them forward without hiking your right shoulder up. See if you can find a lot of space in your right rib tips. Breathe out there. Exhale out the belly. Inhale, right ribs. Exhale out the belly. Inhale and exhale. And then take your breath up even higher to those upper ribs right outside the breast tissue. And exhale. Inhale and exhale. Inhale and exhale. And then firm your left hand into the block. Unfurl your right hand up to the sky. And just let your left ear drape down on the left shoulder top and see if you can find a lot of space in the right side of the neck and the right shoulder top. Don't push or force, but just let it lengthen out like taffy. 3, 2, 1. Now step your right shoulder blade back. Take your right fingertips back a little bit further. Drop your right shoulder blade down towards the rim, back rim of the pelvis, and breathe up under that collarbone. Then dive your right hand into left side waist. Pick up your shoulder, drop it back and down. So we're going the opposite direction. We're still going clockwise because we're on the other side, but we're taking the shoulder in the opposite rotation of the other side. 3, 2, and 1. And then go ahead and release that. Take your block and walk it underneath the left arm. Flip your palm up. Cinch the fingers towards the back edge of the block, but step your right shoulder blade towards the front edge of the mat. Reach it away from the right edge of the spine. So just make space between the medial edge of your scap and the right edge of your spine, breathing into that space. For 3 and 2 and 1. And then release, and you're going to turn towards the left side of your mat, but I'm going to turn all the way around so you can see me. And you just want your left knee slightly outside of your left hip, and you're squeezing an imaginary block or huge medicine ball between your thighs. And again, this right hip is drawing in a little bit. You're going to take your block behind your head and press your skull back. Close your eyes and see if you can remember that moment at the beginning of class where you're balancing your ears over your shoulders and trying not to lose your rib cage to the forward shear. Take an easy inhale. As you exhale, right elbow comes down, left elbow comes back. And you're going to breathe into your lower left ribs for 3 and 2 and 1. And then inhale up and exhale, left elbow comes down. Right elbow comes back. Breathe into right ribs for 3 and 2 and 1. And inhale your way up and exhale down. Breathe into your upper left ribs for 3. Oh, draw your left elbow back and 2 and 1. And then inhale your way up. And exhale your way down. Breathe into your upper right ribs. Draw your right elbow back for 3 and 2 and 1. Inhale your way up. Exhale down. And this time turn towards your right knee. Reach your left elbow towards the ground and let your left shoulder blade follow after the action of that elbow like it's wrapping away from the left edge of the spine. And then breathe into the bottom tip of that left shoulder blade. for 3, and 2, and 1. And on your next inhalation, open your wing, look up at your left elbow, draw your left shoulder blade down towards the back rim of the pelvis, and see if you can breathe up under that left collarbone for 3, and 2, and 1. And then release, turn towards your right foot, curl your toes under, and exhale. Cat arching, this time you're going to block the right foot. Try to get the whole ball of the foot up and over the block. Pull your right hip back, stretching out the back line of that right leg for 3, and 2, and 1. And then just step your left foot forward a little bit or a lot, depending on where the back line of your leg is, how it's feeling today. Inhale, the tail lifts, the sternum comes forward, and exhale, the outer right heel down into the mat. Let your hips shift over towards the right a little bit for 3, and 2, and 1. Inhale, center, and exhale, the inner right heel's dropping into the mat. The hips are shifting over towards the left for 3, and 2, and 1. And then just go side to side with the hips, just feeling that dynamic stretch in the calf for 3, and 2, and 1. And then all the weight in the left foot, we're going to turn the right block, put the heel on it so that the toes are parallel. We're going to walk the other block over towards the left. Reach your right hand further than your left hand, straighten your right knee any amount, and press your hips slightly over towards the right. Take your breath into the outer right ribs, both the lower and the upper ribs, and expand the rib tips on the inhalation. Exhaling out the belly. Inhale, expand. Exhale out the belly. Inhale, expand. Exhale out the belly. Rebend the right knee. Take the block back over near the left foot, fingertips on it, and step that left leg back. Right forearm is buried into the right thigh. If you need more stability here, you can put your whole hand down. We're going to rock onto the outer edge of the right foot, so the big toe mound, the inner arch, the inner ankle bone, the inner knee are out. And choose a position for your hip. So if this is your loose hip, you can pull that in. If you have a little tightness there, you can bump it out to the side a little bit, or you can choose a neutral place. And then we're going to put that toe down, back down, and just feel what that's like, that different position as we inhale and swing the pelvis forward. Open up the upper front intercostals. Try not to lose the low ribs, but reach the base of the skull away from the shoulder tops, and then lift the back of that left knee. Breathing in that space underneath the collarbones for 3, and 2, and 1. And then exhale, cat arching. Breathe into your kidney band for 3, and 2, and 1. And then inhale, swing forward again. Drop the shoulder blades towards the back edge of the pelvis. Just turn on that Q-out contraction. Breathing up in the apical lung. 3, 2, 1. Now keep the shoulder blades moving towards the back rim of the pelvis, and at the same time, drop the lower ribs towards the pubic bone. See if you can get the front edge and the back edge of the abdomen co-activated for 3, and 2, and 1. And then swing through, release into your cat arch. And go ahead and drop your left knee down. Now we're going to take that block down a notch. Walk the right hand forward, cinch the right hip back. Feel a lot of space in your right side waist, and sink your right sitting bone down. You might even take a little sitting bone circle here if you find you've made a little more room for yourself. For 3, and 2, and 1. Now firm your left hand into the block, unfurl your right hand to the sky, drape that left ear down again, reach into your right fingertips, step your right shoulder blade back, and take your fingers back even farther, breathing up under that right collarbone for 3, and 2, and 1. Now we're going to snuggle that right hand into the arch of the right foot. Left block comes down a notch. Tuck left toes under, lift left knee, sink right sitting bone. Squeeze an imaginary block between thighs, hips, ribs. Widen across collarbones, but lift into the dolphin fin, lift the base of the skull. And then just see if you can find your navel, pull it up towards the spine and up underneath the front edge of the rib cage. So you should be working quite a bit here in the whole body, except the neck. We just like the neck to be as soft as possible. For 3 and 2 and 1. Now step your right foot back, downward facing dog. Just notice what you've been working in that pelvis, bending one knee at a time. For 3 and 2 and 1. Now squeeze your knees together, drop your knees down. We're going to swing over towards the left first, this time right sitting bone to right heel. Breathe up under the left shoulder blade. 3, 2, 1. Inhale, downward facing dog, and exhale over to the other side. 3, 2, 1. Now glue your left thigh into your left belly as you launch forward, shoulders over wrists. Pick up between the shoulder blades, between the lift up the base of the skull, and pick that left thigh up a little bit more into the navel as you pick up your pelvis. For 3 and 2 and 1. And then pull your toes into flexion on the left foot, and then step that left foot in between the hands. Lift the blocks up to the highest height and step your right foot forward. Inhale, look halfway up. Exhale, forward fold, and just hang and breathe for a couple of breaths there. For 3 and 2 and 1. And then roll up one vertebra at a time until you come up to standing and give a little shoulder roll to the back. And then inhale your hands up over the head. Exhaling, forward fold, Uttanasana. Inhale, look halfway up. Exhale, step your right foot back, step your left foot back. Come down, knees, chest, chin, or chaturanga. Inhaling, cobra or upward facing dog. Exhaling, another chaturanga if you want one. Downward facing dog. 3 loose, generous breaths here. For 3 and 2 and 1. Inhale, lift the right leg, bend the knees, stack the hips. Get your right glute on, your right hammy on. Draw your right knee a little further back. Next time you're on an inhalation, launch up on the left ball of the foot, and then exhale. Draw that right knee into the chest. Pull the toes into flexion, and then step that right foot in between the hands. Nice job. Step your left foot forward. Inhale, look halfway up. Exhale, forward fold. Take the weight into the heels. Come up with a flat back. Look up as the palms touch. Exhale, we're going to dive right back down. Uttan. Inhale, look halfway up. Exhale, step your left foot back. Step your right foot back. Come down, knees, chest, chin, or chaturanga. Inhaling, cobra or upward facing dog. Exhaling, another chaturanga if you wanted. Downward facing dog. 3 loose, generous breaths here. Inhale, the left leg lifts, bend the knee, stack the hips, get your glute on, get your hammy on, pull your knee back. On your next inhalation, launch up on the ball of the right foot, exhale the left knee to the nose, pull that thigh in, and then flex the foot as much as you can and step that left foot in between the hands. Right foot comes to meet. Inhale, look halfway up. Exhale, forward fold. Take the weight into heels. Come on up with a flat back. Look up as the palms touch. Exhaling, Uttanasana. Inhale, look halfway up. Exhale, step your right foot back. Step your left foot back. Come down, knees, chest, chin, or chaturanga. Inhaling, cobra or upward facing dog. Exhaling, another chaturanga if you want one. Downward facing dog. 3 loose, generous breaths. Inhale, the right leg lifts, bend the knees, stack the hips, get your glute on, get your hammy on, pull your knee back. On your next inhalation, launch up on the ball, the left foot, take the shoulders forward over the wrist, thigh into belly, and then flex that right foot as much as you can and step it forward in between the hands. Inhale, look halfway up, step the left foot forward, exhale, forward fold. Take the weight in the heels. Come on up with a flat back. Look up as the palms touch. Exhaling, namaste. Let's come all the way back down, Uttan. Inhale, look halfway up. Exhale, step your left foot back. Step your right foot back. Come down, knees, chest, chin, or chaturanga. Inhaling, cobra or upward facing dog. Exhaling, another chaturanga if you want it. Downward facing dog. 3 loose, generous breaths. Inhale, the left leg lifts, bend the knee, stack the hips. Left glute is on, left hammy's on, pull the left knee back. On your next inhalation, launch up on the ball, the right foot, take the shoulders forward over the wrist. Exhale, left knee to the nose, cat arch the back, and then really flex those left toes towards the face, step the left foot forward. Inhale, look halfway up, step the right foot forward. Exhale, forward fold. Take a couple of breaths there. 3, 2, and 1. Inhale, look halfway up. Take your hands back to your blocks and step your right foot back. You're going to have your feet a little farther apart like railroad tracks. And then go ahead and stand up. Both your legs are straight. We've got a little bit of a warrior stance here instead of the crescent lunge. But we're going to pull that right hip a little bit forward. Left edge of sacrum is drawing back very slightly. So we're just doing a little bit of work here with that pelvic equilibration. And then we're going to turn the right palm forward and raise it up. And just pat yourself on the back between the shoulder blades. See if you can press that hand toward the shoulder blades, wherever it gets to. It might not get down very far. It might be on the back of the neck. It might be on the back of the skull. But wherever it is, it's just pressing toward the body a little bit. And then take your left hand up to the right elbow and just draw that right elbow a little bit more behind the head. Your fingers might creep down a little bit. Okay, so this is not a rib cage maneuver. We're not trying to shear the rib cage forward. We're trying to drop the ribs, but we're trying to open up the upper front intercostals here. Lift the base of the skull so the back of the neck is long. And just lean back. Your left hand is still holding your right elbow. Your right elbow is becoming a pillow for the head. If you're able to drop your shoulder blades towards the back rim of the pelvis, do so. And breathe up under the collarbones. For 3, and 2, and 1. And then just forward fold, go slowly. You might have a new balance in your pelvis, so just go very slowly. You can take your hands down to your blocks if you want to, or you can keep that elbow stretch going straight ahead. Your choice. For 3. If you have your hands down on your blocks, walk your blocks out as far as you can in front of you. And 2. And 1. And now, even if you have your hands up, release them down to the blocks. And we're just going to take this tiniest little movement. So lift up your big toe mound, your inner arch, your inner ankle, your inner knee, and just bump your hip out very slightly to the side and place your big toe mound back down. If you feel any kind of discomfort or instability, just pull your hip back in a little bit if it's gone too far. But otherwise, if you're okay, just press forward like we did at the beginning of class. You're taking your weight onto your left foot. You're launching up onto your right big toe mound so you can feel what it's like to have the weight on the foot. And then go ahead and lift the right leg any amount. If it feels unstable, you can just hover it right off the ground here. You don't need to take it any higher. But if you feel okay, you can pick your right foot up. You can drop your right hip down. So you're in a warrior 3 sthiti, warrior 3 preparation, but you have that new positioning in that left hip capsule. So it might feel different than it usually does. So just noticing here. If you feel confident here, you can take your hands onto fingertips. If you feel confident there, you can spread your wings. It's okay with me, but just be careful because you're in a new situation. For 3 and 2 and 1. And then either take your hands back to your blocks or right hand around left ankle or left hand around right hand, your choice. Take an easy inhale here, a little tiny dog tilt, the teeniest dog tilt you can make. And then exhale, right knee nestles behind left knee, little bit of a cat arch. Inhale, straightening both legs, a little bit of a dog tilt. This is where we started the class. Right knee nestles, little bit of a cat arch. Inhale, little bit of a dog tilt, both legs lengthen out. Exhale, a little bit of a cat arch. Inhale, a little bit of a dog tilt as that right leg comes behind you. And then exhale, a little bit of a cat arch. And this time we're going to come all the way down and just sit into our Ardha Matsyendrasana. Drop your left hip in an intentional way to try to get it to meet the mat. It might float up. That's okay. We're just reaching. And then the right palm is going to come forward and up. Don't elevate your shoulder. Instead, take your lowest right rib a little higher. And then exhale and twist, pulling that forearm around the thigh and walking your left hand in a tent behind you. Take your whole pelvis over towards the right a little bit, but push your left knee into your right elbow, and then take your right belly to the left. Pick up the base of the skull, reach it towards the top of the head, and then turn your gaze over your left shoulder. For 3 and 2 and 1. Now leave your twist where it is, but just turn your gaze over your right shoulder. Keep pulling in with your forearm, just noticing that change we're making in the posterior hip capsule. 3 on the left side, and 2 and 1. Now leave your twist going left, leave your nose going right, take your gaze to the left. Your eyes and your belly are turning left, your nose is turning right. For 3 and 2 and 1. And then release. Take a tiny counter twist. And then you're just going to swing your left leg around behind you and come into a pigeon. So you want to get something underneath your right glute so it's not floating and so you're not capsized over towards the right. Your right shin can be parallel to the front edge of your mat, or your right heel can be very close in to the pubic bone, however you want it. Just tune in to that lumbar arch on the left side. See if you can pull that left shoulder blade down towards the left rim, back rim of the pelvis a little bit more as you, not shearing your ribs, but as you open up in the upper front intercostals. For 3 and 2 and 1. And now go ahead and take your forward fold, dropping down, feeling that stretch in the outer hip, right side outer hip. Hopefully you're even getting some movement into a new spot. We did all this rebalancing work. For 3 and 2 and 1. Now leave your sternum low, but walk your elbows over towards the right. And then tuck your left toes under and reach your heel back behind you. Contract your right sideways, but hike your left lowest rib away from the left hip crest. For 3 and 2 and 1. And then release. Plant your hands in front of you. Step your right foot back, downward facing dog or child's pose. Take your choice here. A couple of loose, generous breaths. For 3 and 2 and 1. And then walk your feet up to your hands. Inhale, look halfway up, and exhale, forward fold. For 3 and 2 and 1. Okay, inhale, look halfway up. Exhale, step your left foot back and make your feet a little further apart so they're in train tracks. But your left foot's in a little bit of a warrior one stance. And then just come up to standing and just balance your pelvis a little bit. We're going to take that right edge of sacrum back slightly. Left hip is coming a little bit forward. You're just trying to get the top edge a little bit equilibrated. And then this time the left palm is going to come forward and raise. You're trying not to lift the shoulder top, but pick up the lowest left rib and then just pat yourself on the back. So it may come to the back of the neck, it may come to the back of the skull, or you might be able to reach between the shoulder blades. But wherever you are, you're just giving a little pressure of that hand towards the body or towards the head. And then the right arm's going to come up and hold the left elbow. It can maybe draw it a little further behind the head, or maybe not. It's okay. So try not to shear forward too much into your low ribs. You're trying to drop the low ribs. You're trying to open up between the sternum and the collarbone. And you're just taking a little look up, lengthening back of neck. You're noticing that movement from the shoulder blades to the back edge of the pelvis. And you're breathing up under the collarbones. For 3 and 2 and 1. And then just very slowly come into your forward fold. You could let your hands go and bring them down onto the blocks, or you could keep that elbow reaching forward. But if you take your hands down onto the blocks, walk your blocks out in front of you as far as they can go. For 3 and 2 and 1. Now, wherever your hands were, let them come down to the blocks. We're going to take this little action of rocking up so the big toe mound lifts, the inner arch, the inner ankle, the inner knee lifts. Choose your position on your right hip and then set that big toe mound back down. And then we're just going to launch off the back of the foot into the back left big toe mound and feel a little weight into that front foot. Go gingerly at first because you maybe have a little bit of a new hip position. If it's too much wherever you've chosen, just pull it in a little bit more to stabilize. And then when you feel ready, hover your left foot up. You could keep it low, but if you feel comfortable, you can lift that leg a little higher. You can drop your left hip down and lift your foot up. If you feel comfortable there, you could take your hands, fingertips on the blocks. And if you feel comfortable there, you can go ahead and airplane your arms, but don't go anywhere where your hip feels like it's going to get too much weight in unstable position. For 3 and 2 and 1. And then take your hands back to your blocks, or left hand around right ankle, right hand around left hand. Inhale, give a little dog tilt here, tiny little dog tilt, and then exhale, tuck your left knee behind your right knee and almost touch it down as you give a little cat arch. And then inhale, little dog tilt. And exhale, little cat arch. Inhale, extend both legs, give a little dog tilt. Exhale, folding, little cat arch. Inhale, straightening both legs, pushing down into right heel, dog tilting. Exhale, little cat arch. And this time we're going to come all the way down to the ground and just drop your right sitting bone down towards the mat. Turn your left palm forward, and without lifting up your left shoulder top, pick up your lowest left rib. And then exhale, catch the outside edge of your thigh, pull it in towards the body with your left forearm, and take your right fingertips behind you. You're going to press your pelvis over towards the left a little bit. Push your right knee into your left elbow and turn your left belly to the right. Pick up the base of the skull like you've got a strap and you're pulling, and look over your right shoulder, breathing into the bottom tip of your left shoulder blade. For 3 2. And 1. Now keep twisting everything the direction it's going, except your head is going to turn the other direction over your left shoulder. 3. Pick up base of skull, pick up base of skull. And 2. And 1. Now leave your nose the direction it's going, but take your gaze to the right. Your belly's going right, your gaze is going right, your nose is going left. For 3. And 2. And 1. And then release and take a tiny counter twist. You're going to swing your right leg around. A little blanket or a little block underneath your left hip. Your left shin can be as parallel to the front of the mat as you want it. And then just while you're here, hands onto blocks or one hand on your foot, one hand on your knee, just see if you can drop your right shoulder blade towards the right rim of the pelvis, finding that little QL contraction on the right side as we open up the upper front intercostals for 3 and 2 and 1. And now go ahead and take your forward fold. And again, just check in to that left posterior hip capsule. How's it feeling back there? Is it feeling different from the practice? For 3 and 2 and 1. Now leave your sternum low, but walk your elbows over towards the left. Try not to hike your right shoulder blade up. Tuck your right toes under. Reach your right heel back. Pry your lowest right rib away from the right hip crest as you breathe into the rib tips. For 3 and 2 and 1. And then release. Hands to mat. You're just going to come back downward facing dog or child's pose, wherever you'd like to go with that. For 3 and 2 and 1. And then go ahead and find a little inversion. So you could take your legs up the wall, or you could take a little bit of a shirsha. Wherever you feel like going in your practice right now is totally fine. Just try to get your feet above your head. Very nice. Stay up as long as you'd like. Just noticing lymph and blood flowing back down toward the pelvis. For 3, 2 and 1. Okay, if you're not done, feel free to stay up, but if you're all done, go ahead and come down child's pose or turn over onto your right side if you've just got your legs up the wall. And then press yourself up to seated and just take a look at me. Okay, so we're going to go ahead and find a little bit of camel action here. So we're going to put our knees, you can have them on a blanket if you want to. You can squeeze a block. Let me turn this way. I think it'll be easier for you to see at the beginning. You can squeeze a block here if you want to for stability. I've got my toes tucked under and I would recommend that. So we've got this feeling here of this squeeze towards the midline, but we've done a little work rebalancing the pelvis, so we might feel a little bit differently in this position. And we want to go for as much stability as possible. So we're not going to go for depth, but we're just feeling what it's like in this newly balanced pelvis to do a little bit of that back work. So squeezing block between the knees. an imaginary block between the hip crest and between the rib cage. And again, I've got my toes tucked under so I don't have to go very far. I want to start off by engaging my glutes, engaging my hamstrings so I can make the action of lifting the heels up to get that back leg on like we were working in the standing leg of our Anjaneyasana. Now that I've got that squeeze on, instead of shearing forward like this, I want to drop the low ribs down, but press the hips forward a little bit and then open up here. We're going to take the hands face up onto the back edge of the sacrum. Long back of neck, just look up. For 3. Breathe under your collarbones. And 2. And 1. And then just let that go. Forward fold. You didn't go as deep as you could. You're just feeling something new. Take a couple breaths in your child's pose. For 3. And 2. And 1. And then roll up and find that squeeze of the block again. So my knees are squeezing the outer edge of a block. I've got my hip crest coming in. I've got my ribs moving towards the center line. And again, I'm just trying to keep my low ribs dropping. I'm trying not to lose them in this kind of fashion. But I can let my hips come forward, and I want to open up here between the sternum and the collarbone. Now this time I'm going to take my left hand out to the side. I'm going to step my left shoulder blade back, and then I'm going to reach my left fingertips back, and I'm trying to breathe up under my left collarbone. And I might even be able to take that left hand into my right side waist or to my right heel, depending on how I'm feeling. Right palm's going to come forward and extend. I really want to feel my glutes. I really want to feel my hammies working as I extend from the lowest right rib up through the fingertips. For 3. Really beautiful postures. And 2. And 1. And then just let that go. Again, you didn't go as deep as you could. You're just feeling that twist on the stability of the new pelvis. And then go ahead and come down, child's pose. 3, 2, and 1. All right, here we go. Third time. Squeeze your block, tuck your toes, get your glutes on, get your hammies on. You really want to get as stable as you can there. And then we're going to drop the ribs, open up the upper front intercostals. The right hand's coming out to the side, and the right shoulder blade is going to step back. The right hand is going to come back. I'm breathing under this right collarbone, and I'm going to dive the left hand either into the right side waist, or if it's there for me, I'm just going to touch that left heel. Left palm comes forward and up, stretching from lowest left rib up to left fingertips, breathing those left rib tips apart. Turn. For 3. Here you're going to feel the restriction of the left respiratory diaphragm, which is very immobile in a lot of people. And 2. And 1. And then release. And go ahead and come forward into your child's pose. Just rest and breathe there. For 3. 2. And 1. All right, and now we're going to find our alpha ball. We're going to take it right into the right glute. So just find a nice juicy spot in your right glute, rolling around there. If you find a good place, you can take your right knee in the air, pin the ball, and rotate the knee. If you need more sensation, you could lift your left heel off the ground, or you could pin your knees together and take them in one circle. This side probably had less movement in most people, but still might have changed quite a bit. You might be able to feel some muscular objection. 3, 2, 1. Now stretch out your right leg long, turn your navel 45 degrees to the right. And then if you feel like it, you can come up on your forearm, bury your right edge of foot out down into the mat, and then bend and straighten your knee. So you're rolling on the back fibers, the externally rotating fibers of your glute med. 3, 2, and 1. Now you're looking for this little bump on the outside edge of your hip, your greater trochanter. You're going to turn your navel 45 degrees more and just make a circle around that bumpiest, boniest part you can find of your outer hip. All the ligaments and stuff hang on that little bump. So you're just rotating around it with the ball. For 3, 2, and 1. Now step your left foot in front of your right thigh and turn your navel 45 degrees more. So it's like that ball comes into the front pocket of your jeans, and just try rolling around though on your TFL there, this little muscle right at the top of your IT band. 3, 2, and 1. And then go ahead and roll that ball into your sideways so it's above your hip crest and below your bottommost right rib. Inhale towards the ball, puff up your sideways towards the ball, and then exhale, sink down, sink a lot of weight onto it so the ball navigates into your visceral cavity. Inhale, puff up. Exhale, sink down. Inhale, puff up. Exhale, sink down. Inhale, puff up. Exhale, sink down. Now, keeping as much weight as you can on the ball, just go ahead and take a few pelvic tilts. As you dog cat, you're just trying to get that ball to navigate its way a little deeper into your side waist. For 3, and 2, and 1. Now we're going to take that ball right into the inside of your right hip crest. You're going to turn on your belly. If you can't feel that, you can put a block underneath you and get the ball on the block and get the belly on the ball right inside that hip crest. Inhale, puff up towards the ball. Exhale, sink down. Inhale, puff up. Exhale, sink down. Inhale, puff up. Exhale, sink down. Now, keep as much weight as you can on the ball and walk your elbows over towards the left. Try not to hike up this shoulder, but you might be able to move your right elbow a little further away from you than your left elbow, and then tuck your toes under and reach your right heel back. So you can feel a lot of tautness on the ball. And then just bump your right hip over towards the right so the ball reaches towards the left. And you want to steer it towards your left shoulder a little bit so it's kind of reaching towards your navel. And then you're just going to come into the edge of your psoas. If you can move side to side. If you can't, just hold still. For 3, 2, and 1. And then when you're all done with that, just come off, turn over and lie flat on your back and see what you can notice. Just happened in that little brief roll along the right side. Notice integration of the musculature from the right foot up to the right shoulder, spaciousness, all that good stuff. And then when you're ready, we're just going to go to the left side. So take that into your left glute. You're looking for a little owie bit, and then you're going to lift your left knee and take it into a circle. If you need more sensation, you could pick up your right heel or glue your knees together and take that circle. And that's going to really help your piriformis to kind of pop out and get a little bit more sensation. For 3 and 2 and 1. And then just extend your left leg out. Turn your navel 45 degrees to the left. Stay down there, or feel free to come up on your forearm. Bury the outside edge of your left foot into the mat and bend and straighten your knee. And just feel those back fibers of your glute med. For 3 and 2 and 1. And then turn your navel 45 degrees more and find that greater trochanter bump on the outside of your hip, and then just make a circle around it like you're drawing a donut right around that bone. Really good to do when you're doing any kind of rebalancing work. 3, 2, 1. Now step your right foot in front of your left thigh and turn your navel 45 degrees more. So it's like somebody tucked that ball into your front pocket. Just roll around TFL just at the top of your IT band there. 3, 2, and 1. Now we're going to roll into the side waist here. So up above your hip crest and below your left lowest rib. Inhale, puff up into the ball. And then exhale, sink down onto it. Inhale, puff up. Exhale, sink down. Inhale, puff up. Exhale, sink down. And then just keep as much weight as you can on the ball. Start to take a little dog cat tilt, like you're trying to wend the ball in a little closer towards your midline. 3, 2, and 1. And then we're going to take it right inside that left hip crest. You can either put your belly on the mat or on a block. So ball on block, belly on ball. Inhale, puff up. Exhale, sink down. Inhale, puff up. Exhale, sink down. Inhale, puff up. Exhale, sink down. Now keep as much weight as you can on the ball and walk your elbows over towards the right. And without hiking up your shoulder top, see if you can reach your right elbow a little further than your left. Tuck your toes under and push your left heel back. And then just press your left hip over towards the left a little bit so that the ball moves towards the right. And you want to reach it slightly towards your shoulder. It's kind of on a diagonal track towards your navel. And that's going to help you catch the edge of your psoas. Usually know it when you find it because it's pretty sore. And then you can move around, or if you need to hold still, hold still. But if you can get a little movement right into the edge of it, you can see if you can loosen up that tight edge. For 3 and 2 and 1. And then whenever you're ready, just let go of that and turn over on your back and just notice what you were able to let go of, and if your left side caught up with your right side. If you want to roll your neck or some other place, go for it. Otherwise, just find a Shava pose and sink down into it for a few moments. Take an easy inhale through the nose. Long, slow exhalation out the mouth. Inhaling nose, sighing out the mouth. Inhaling nose, let everything go. And rolling over on the right side into the fetal position, just taking a moment of gratitude for the miracle of your body, for your strong legs and your strong arms, for the good gift of eyes that see and ears that hear. Such amazing blessings. And then grounding left palm into the mat, come gently up to seated, allowing head to hang until the very end. And just allowing arms to float up and palms touch. Thumbs to forehead, asking for generous thoughts, and to the lips for kind speech, and to the heart for clear intentions. Namaste.